It's interesting because the goals in cancer care for so long have just been survival, which obviously is still the main concern and goal when you're dealing with cancer. But for women who are young and have oftentimes not been offered any opportunity to preserve fertility or really understand what implications or ramifications their treatment might have on their ability to have a family, that's become a huge point of emphasis as we have been much more successful in our treatments and survival. And based on some very pioneering work done in France, where a procedure was developed to remove the same amount of tissue but preserve the fallopian tubes, ovaries, and this part of the cervix along with the uterus and reconstruct it to the vagina without compromising cancer care, we've been able to develop a procedure which allows us to treat a cervical cancer with the same radical surgery but preserve the uterus and the proximal part of the cervix. And we've been able to reconstruct the tissues in a way that a young woman could preserve the choice of having a child. And we've only been doing this procedure for about 5 or 6 years. It's not a common procedure. We do about 6 of them a year. I do all of them here, but we have 5 term babies so far, and we haven't had any negative outcomes with respect to the ability to carry a child. So it takes a courageous woman to want to do this, but the survival data is outstanding, and the technique now I think is very streamlined, and we know what we're doing, and it's a reproducible technique that we have to offer. So it's a pretty exciting thing for an oncologist to be able to develop something, have women work with me collaboratively and together and find out it's something that's worth doing, and now it's something we can offer routinely to young women who have cervical cancer. I really am a surgeon at heart, always have been. It comes very easy to me, and between being able to operate well and talk to people and be personable and personal experiences in my own life dealing with the loss of my dad and my sister really informed me on how I could be effective and helpful even if we couldn't cure the cancer. So it seemed like the right thing for me to do, and I don't think it was the wrong choice.